Good morning. Hello everyone. Today I shall discuss with you the role of devil's claw and its extract in the treatment of osteoarthritis, which is very common disorder as the age. It must be understood that the treatment with herbs and Ayurvedic medicine must be done in consultation with an Ayurvedic expert. Devil's claw has so many similar names: bat head root, devil's pod, wood spider, grapple plant, tiger claw, ullatkanta, and in various countries, for example in France, Graffe du Diable, in Germany it is temple kit, and in Africa is extremely commonly used for medicinal value and is called as wolfskin coat. Bichupal and Bagnakha are the Hindi names. Some authors have described devil's claw for the plant Martina annua, and we will know later on that most of the time devil's claw is not Martina annua, different. It is Hypogophytum procubans, a plant which is found in the South African deserts, and the other species found there is Hypogophytum zaheri. The fruits have hooks which attach to the roaming animals, and this gives the name. Roots and fruits have active ingredients, and the roots of the devil's claw plant containing active ingredients are used to make supplements and extracts for natural health remedies. Extract is prepared from whole plant, roots and or tubes. Whole plant extracts are better than extracts from isolated. The composition of the devil's claw: terpenoids, iridoid glycosides, simple glycosides, acetylated phenolic compounds, complex sugars, mainly tetrasaccharides, stachyose, phytosterols, primarily beta-cetosterol, aromatic acids, caffeic acid, cinnamic acid, and chlorogenic acid, and the bioflavonoids such as luteolin and camphorol. The iridoid glycosides are important, and of them, hypagoside is the most important. Hypagide and procambide are also others. And hypagoside content of tubers is more than others. Secondary storage tubers contain twice as much hypagoside as the taproots. The content of harbocoside varies from 9 to 27%, and commercially available extracts, for example, containing 600 mg of the crude extract would have 50 mg of the active hypagosides. Other minerals are also. There are a large number of uses of this claw since antiquity. It is used to stop bad evils and is still used in Africa as a wishing root. The plant is extensively studied for medicinal properties, and it is important to know that not in India, Ayurveda is also rampant in many other countries. The description of the devil's claw is found in Pharmacopoeia of Germany, France, Great Britain, Ukraine, Sweden, and European Commission has prepared a special monograph on it, whose reference I have given. It is also included in World Health Organization Compendia also. In South America, Africa, it is traditionally used as tea, decoction, ointment, powders, and medicines for gallbladder, liver, kidney, urinary bladder disease, malaria, fever, menstrual problems, inflammation, syphilis, as a bitter tonic in digestive disorders and also in painful disorders. And it is also used on as external use in skin disorders. In modern medicine, especially in Europe and North America, Martinia root, which is synonymous to hypophytum, is widely used in the treatment of patients with inflammation resulting in musculoskeletal pains such as osteoarthritis, rheumatoid arthritis, pain in the lower back, fibromyalgia, osteochondrosis, It is also tried as anti-obesity drug. Now, I'll first focus on the efficacy in osteoarthritis. Bryan et al. Reviewed the evidence from all the 14 studies done during 1966 to 2006, and he concluded that there was some evidence of the efficacy in pain relief, but minor GIT adverse effects occurred which were much less as compared to non-steroidal pain-relieving drugs. Similarly, Wagner and Lubke in 2003 studied effects of the aqueous extract of secondary tubers containing 50 mg hypoglycemia daily in osteoarthritis in low back and found that there was a significant reduction in the symptoms, improved functional ability, and some minor tolerable adverse. A systemic review done by Garnier et al. In 2004 that included all the studies between 1996 to 2003, they concluded that various types of the preparations are used. There is little lack of the strong evidence for the treatment of osteoarthritis, but they are effective in the treatment of chronic non-specific low back pain, for which there is a strong evidence of their efficacy. They are well tolerated. Now, in backache, the standardized claw extract called as herpedol is commercially available, that has been administered in a dose equivalent to 57 mg herpagoside for 4 months in 122 patients suffering from knee and hip osteoarthritis, and compared to 100 mg daily of the diacerin, which is the alternative NSAID for the treatment of osteoarthritis like aspirin. Herpedol was shown to be at least as effective as diacerin, but side effects were less, so with tolerability. In low back, another study, Chubasik et al., it has done a lot of work. These authors have done a lot of work, and they found to be effective. Here they have used another commercially available preparation, dolotefen, that contains 60 mg equivalent of hypoglycemides. And the study was conducted for 8 weeks, and they found significant improvement over 70% of cases, and 10% developed minor tolerable adverse effects. Almost similar study was using dolutegravir versus rofecoxib was done, and it was found to be effective. Rofecoxib is no longer used because of it is banned actually because of adverse cardiac effects. Anti-inflammatory activity is there, and what is the underlying mechanism? Experimental evidence is there to show that there is a suppression of release of pro-inflammatory cytokines. There is a reduced formation of the inflammatory mediators, enhanced synthesis of chondroitin and glucosamine, cartilage production, inhibition of prostaglandin formation by reducing expression of COX-2 and 5-lipooxygenase enzyme. Also inducible nitric oxide synthesis in fibrin. Chung et al. Reported anti-osteoporotic activity of herpagide, and herpagide effectively inhibited the serum levels of the biomarkers of the bone loss, alkaline phosphatase, osteocalcin, C-terminal telopeptide, and tartrate-resistant acid phosphatase. Downregulation of the nitric oxide pathway and antioxidant activity has also been. There are many other activities which I will not focus, just I will mention about anti-diabetic activity of the devil's claw. Muhammad and Ojewal reported blood glucose lowering action along with anti-inflammatory action of the plant extract. Now, Exaba et al. Also reviewed the articles published between 2011 to 2022 and found anti-inflammatory analgesic activity in a number of musculoskeletal disorders. The authors stress that more research is needed to find out the actual evidence of its efficacy. Safety tolerability of any drug used is important. The devil's claw extract has been found to have very low animal toxicity. While generally it is considered safe for long-term use in South Africa, it can cause side effects like diarrhea, indigestion, allergic reaction in about 3% of users. Devil's claw might increase bile production, so it should be avoided in patients with low cholesterol. There are cases who have developed low sodium, therefore this must be monitored. It may aggravate peptic ulcer by irritating stomach, so it is best avoided. It has uterus stimulating activity, so should never be given in pregnant patients. A potential of drug interaction should always be considered. The extract has mild inhibiting effect of the drug metabolizing enzymes, therefore drug levels may increase. It also inhibits the P-glycoprotein extrusion pump, and therefore bad interaction will occur with many drugs given concurrently. Therefore, utmost caution and monitoring will be required if patient is taking low-dose aspirin, anticoagulant warfarin, and proton pump inhibitors. Very important thing is, as discussed earlier, devil's claw extract may reduce blood pressure as well as blood glucose. Therefore, patients taking multiple drugs with multiple disorders should closely be monitored by a competent medical doctor whether there are adverse effects or not. Patients who have cardiac arrhythmias or patients who are taking antiarrhythmic drugs should not take devil's claw at present. Devil's claw in various formulations have been used: crude aqueous root extract, dried root powder as capsule or a tablet, tincture, liquid, extract. Therefore, in various formulations and various doses, it should be understood that the best is to make an equivalent of 50 to 100 milligram harpagoside to be taken daily for a period of duration studied 3 to 6 months. It should be noted that devil's claw extract is given in usual dose of 612 milligram extract, whereas active ingredient 50 to 100 milligram harpagoside is there. Doses which contain less than 30 milligram harpagosides are not very effective. So those should be more than 50 milligram, but not more than 100 milligram to 200 milligram per day. So conclusion is that is devil's claw extract is used in a number of ailments since antiquity in South Africa and other countries. It is extensively being studied in animals and humans for its efficacy and safety in musculoskeletal disorders. It is found to have anti-inflammatory, counterproductive, anti-osteoporotic, and antioxidant activities. In a large number of randomized controlled trials with placebo or active drug, its efficacy in osteoarthritis, rheumatoid arthritis, and low back have been found to be equal to NSAIDs, which is actually moderate, not very high, but also appears to be safe and well tolerated compared with with NCRs, and it has low toxicity. But there is a need to explore long-term effects in halting ongoing joint destruction osteoarthritis and its ability to prevent initiation of the joint degeneration when used prophylactically in suitable adult groups. Time will tell. Thank you very much. These are the references which you can access for knowing more about and I have tried to include good references. Next presentation will be other active herbs in osteoarthritis. Thank you and good day.